Okay, I think it's time to start. It's 10:45. So I want to say welcome to everyone. Welcome to this session in non-toxic healthcare. My name is Sofia Dahling, and I'm the member and community coordinator at Nordic Center for Sustainable Healthcare, and I will be moderating this session here today. Before I start presenting the speakers, I would like to go through a few practical things about the platform that we're using, Deal Room. If you have any questions to the speakers, you're welcome to ask these in the chat function that you should find in the right-hand corner. Since we're a bit short on time between the speakers, I would ask you to answer the questions during the presentation so that the speaker can answer them right away when they're done. Also, I would kindly ask the speakers who are not presenting at the time to make sure that their microphone is off or muted. The topic of this session is non-toxic healthcare, and we're going to talk about different toxins and chemicals and how we can be exposed by these through air, water, clothes, and furniture, for example. We're going to talk about how these can affect our health and how we can work to phase them out, choose better options, and how to make healthcare more non-toxic. We have 4 competent speakers with us today that are going to talk about this subject from these different perspectives. And instead of taking up more time, I'm just going to present the speakers now. The first speaker in this session is Anders Gripenberg. He's the CTO at Xinix International, and he's here today to talk about spore-building bacteria and how it affects our health. Okay, Anders, you are welcome to take over the screen. Thank you.
Thank you for that. Xinix, disinfection for health, that's what we do. We have been existing quite a long time, 28 years actually, so we're not new in the field. My name is Anders Gripenberg, I'm CTO of Xinix International, and this is my email address. I will not be able to be in the chat room afterwards. I'm heading for Bangladesh, so please write emails to me if there's any question I can't take right now. I will be talking about these pretty beautiful guys. This is a nice illustration of spore-forming bacteria. Actually, they have like two shells around themselves and makes them very difficult to get rid of. But they're quite beautiful to look at, actually. There are some really nice guys, but there are some really bad guys also. Spore-forming bacteria, the worst scenario, and I hope I'm wrong in my predictions here. Today's challenge is healthcare-associated infections. Healthcare-associated infection is actually different kind of part, but sepsis is one of the most common. And you know about sepsis, please raise your right hand. And so some of you don't know about sepsis, but that's a complication of infection that can be really contagious. There's a lot of information about sepsis. The WHO presented the 26th of August this year, a new presentation about sepsis. Go in and have a look at it. It's very informative. Also the cdc.gov, a lot of information. The most common bacteria which causes this infection in sepsis are Streptococcus and E. coli. These guys are not spore-forming bacteria. 2017, we had about 50 million cases of sepsis, and about 11 million died from that. This is also presented by Lancet this year. Cancer deaths are about 10 million every year, less than 10 million every year. If you look at it in perspective, COVID-19, 26 million cases and 900,000 deaths from Johns Hopkins. That gives you an idea of what is actually sepsis and what's cancer. Now, with that said, is Sweden doing the right thing and Denmark, Finland doing the wrong thing? No, definitely not. Guys in Denmark, Finland, and Norway has done the right thing. We in Sweden have done the wrong thing. 5,800 deaths is not acceptable. Back to healthcare-associated infections. What it's about is about hygiene routines, actually. It's clothes, it's cleaning, it's hygiene. We have excellent hygiene doctors and nurses in Sweden and everywhere in the world writing these instructions how to behave during hygiene routines. If they follow them, we will have really pretty almost no healthcare-associated infection. Unfortunately, our statistics from experts says that we have about 1,400 deaths in Sweden with about 65,000 cases, costs about 6.8 billion Swedish crowns. yearly. This is much more people than dies in traffic, so it's a lot. Now, there was a study. During 2 weeks, they checked 27,990 people working in the healthcare sector. They have a result of 74.5% follow the hygiene routines. That means that 25% didn't follow the hygiene routines. This is quite alarming, shocking numbers. And what else was that? We put RFID, radio frequency ID, on the staff, monitoring dispenses, monitoring time, and time went rapidly down in how much time they spent doing the hygiene, following the hygiene routines. This is also published in Health Policy. Have a look at it because it's quite scary numbers, these 25% not following hygiene routines. Now, US have made it for quite a few more years. They have better statistics. 687,000 that came to acute care hospitals, 72,000 died. Now there are 4 different kind of hospitals, acute care hospitals, that's what we're talking about here. This is figures from 2015 from cdc.gov. Cost direct cost $30 billion USD, indirect cost $147 billion US dollar. US has done these surveys much longer time than we in Sweden, so they have better figures than we have. And what we can say about this, 2018, they presented new results and healthcare associated infections went down. So all the 50 states did better actually, and that's still too much. We talk about toxic disinfection healthcare. What we have is different kind of products. We have ethanol, which is a neurotoxin that numbs the brain cells. If you use ethanol, that's the most common disinfectant product that's used in the healthcare sector today. That should be at least 70%. If it's less, don't use it. Unfortunately, there's some types that are less than ethanol-based products, there's less than 70%. Methanol should not be in the sector at all. FDA found that more than 40 companies had methanol-based products, the rest of methanol in their products. We have also had problems in Sweden with the university chemist making some hand sanitizers for the academics in Uppsala that cause skin burns. Methanol is not a product that should be existing in the healthcare sector. It's a propanol, very common used as a disinfectant. If you breathe it in a lot, you can even get unconsciousness. This is from Swedish Poison Center, so this figures is quite accurate. And they have the hydrogen peroxide, causes skin burns. Now, 3% is the maximum, that's the maximum allowed in skin in hydrogen peroxide. But unfortunately, you can even get as much as 12% in the hair sector. You put 12% on your hair and into the skull, and imagine what that does to your cells in the head. Hydrogen peroxide, much less than 3% should be. If you have more than 3%, don't use it. Think about it when you read the instruction on hydrogen peroxide. There is warning that if you get a itchy feeling in your hands, don't use it. Healthcare staff needs to do disinfect their hands 30, 40, 50 times every hour. Should they do it with hydrogen peroxide? No, they should not. Now we're talking about non-toxic healthcare. First of all, choose product evidence-based products according to different EN standards. 1500 is hand sanitizers. The other one is for different kind of bacteria. 12054 is for spore-forming bacteria. Never choose product that doesn't have this information. I've been looking at this market during now the pandemic, and there's a lot of product that doesn't have any kind of EN standards at all. They claim that they have a percentage of 99.9% disinfection, but usually they have not even tested it in according to EN standards. Ecolabelling products. If you find ecolabelling products, buy it. Unfortunately, there is no hand sanitizer that has ecolabelling products yet. Hopefully, will be later this year. And then we have products from producer with national EU registration. Choose these ones. Don't choose the ones that doesn't have any registration. There will be Chinese products and other products coming all the time, and they are not that very popular, not very good at all. Choose that are registered in the national and EU registration products. Finally, producer with high code of conduct, ethics, social, and environmental agenda. Don't choose product that doesn't have this. Avoid these companies that doesn't have any kind of this agenda at all. Okay. Also, they must have a sustainable agenda. How and where? If they don't have an agenda, don't choose this. Put demands on your suppliers that they actually have all these kind of registrations, all this kind of code of conduct, etc. That it's a company doesn't have it, doesn't take care of Mother Earth. Now, what kind of disinfection methods do we have and the negative parts of it? We have UV light, ranked as the best one. You have UVC 265, lead, used to be mercury and used to be xenon. They are gone from the market now. Also, you used to have no exposure patient and staff. That has been increased and better today. UV light has a problem with biofilm and bacillus spores, but it's getting better and better. But hopefully they are getting better, so we have more UV in healthcare sector as a disinfectant. Chlorine has been used, especially on surfaces. It doesn't have any effect on sepsis, of course. No effect on bacillus spores or biofilm. Pretty good on water disinfection, but that's it. Not good for the environment, though. Ethanol, no effect on naked viruses. We have winter sickness in Sweden. That means that we call it winter vomiting sickness, actually. Ethanol doesn't have any effect on naked viruses. Then you have bacillus spores, doesn't have any effect on that. Biofilm, of course, it's a big problem with biofilm in healthcare sector in different kind of medical devices like heart and lung machines, etc. Of course, nothing with water. Hydrogen peroxide, no effect on naked viruses, tuberculosis, biofilm. This is a big problem in healthcare sector. Then we have Xinix products, chlorine dioxide. Chlorine dioxide is well known as a very, very good disinfectant. It's been there for years, it's been used for in vitro diagnosis. You have made them two together. What we have done, we have stabilized it in a form that we have a shelf life of 12 years today. We can, without problem, say that we're pretty good in doing this. We have delivered to many disasters around the world, the tsunami, Haiti earthquake, Pakistan earthquake, and others. And we think we're pretty good in what we're doing. We know what we're doing, we've done for 28 years. We've done a lot of tests with our products. We have evidence based on what we do. I will come back to that. So today, healthcare-associated infection. Tomorrow's spore-forming bacteria. I'm predicting that I'm wrong. I hope I'm wrong. We have the problem with the following kind of bacteria. Used to call Clostridium difficile, now it's Clostridium difficile. We have Staphylococcus aureus, norovirus, E. coli bacteria. Other ones in HAI is CRE, MRSA. These guys, Clostridium difficile or Clostridioides and MRSA, are highlighted because they are actually spore-forming bacteria. Now, since they are a problem in the healthcare-associated infection, they can be a really big challenge for us if we can't find a way of keeping them down. There are many good spore-forming bacteria that we use for different kind of reasons in production, etc. But these guys are really bad guys, and we need to take control of those. And we can do it by using the right kind of disinfection methods and products. There are also two other ones that is quite bad guys: Bacillus cereus, food poisoning, and of course anthrax. 2001, we had an anthrax outbreak in the US Post Office. 11 people got affected, 5 of them died. Anthrax is a really bad guys, and we should be very aware of these kind of bacteria. So C. difficile, MRSA, anthrax cereus, these spore-forming bacteria can be a big problem in the future if we can't handle it in the proper way. Spore-forming bacteria is problem with this, they survive everywhere, like in soil, water. They can exist for 250 million years. They can be on surfaces for many years. They have found spore-forming bacteria in sarcophags in Egypt that had been sitting there for a couple of thousand years. Same kind of DNA they found actually also in flies and bees in Dominican Republic. Spore-forming bacteria is a big problem. In this case, because it's very difficult to eliminate them. Back to tests that Xinix has done. As I told you, we have done a lot of tests. All the way back in 2000, we cooperated with Johns Hopkins in testing our products. 2007, we did the first spore-forming test with Battelle Institute in the US. We followed that up with University Hospital in Örebro on 2007, 8 and 9, and we did some many good tests on spore forming, especially on C. difficile. And we got approved results compared to ethanol-based product that is non-approved. We follow that with the EN certification on our products for 2018. And as we speak today, WHO got our products and doing tests with our products, and hopefully we'll get results within 2 weeks from them. That would be very good for us. We are also doing tests with Pasteur Laboratoire in Côte d'Ivoire on the worst bacteria that you can find, viruses. So we have a lot of track record about our products. Now, we have started creating a foundation that will be presented this year. That part of our sustainability policy. The reason for that is that with 5% of all our revenue we donate to this foundation. We cooperate with WaterAid, Red Cross, United Nations Organization. The reason for this is because 2 billion people don't have access to basic sanitation facilities in the world. Now we want to help solving these problems. But 2.5 million children, but I think it's 2.9 million children actually under age of 5 dies every year. That is also part that we want to solve. Through cooperation with WaterAid and these other organizations, we can help solve this problem. The most people dies in sepsis are sub-Saharan countries. Most is during childbirth and the early weeks of the child. And that is a lot of problems, E. coli and other. And we can solve these problems. We can do this, but we need some help from others. And we need to cooperate and find a solution for that. And of course, we need to cut down costs for everything because they don't have the money actually to pay for what it costs. So that's a reason for our foundation. Our products are 99% water. That means that we don't use a lot of different kind of chemicals. We use chlorine dioxide. It's an environmental friendly product. We use reused bottle PET that's been collected. All our material is reused. We have a circular economy thinking in everything that we do. We have, of course, an environment and climate responsibility in everything we do. We think of how do we cut down costs, how do we take care of Mother Earth in best ways. Of course, we have a social responsibility. Doesn't matter your gender, you get the same equal pay for that. Xinix Foundation will be 100% transparency. That means that all money that we are collecting will be presented every month. What they are being used for will be presented every month. So this is 100% transparency in everything we do. Thank you for your time. We consider ourselves as a leading disinfection company now. We will be the largest by 2030 in the world, definitely. Our goal, bacteria-free drinking water, a human right. Contact me, please. I'm on my way to Bangladesh, so I will not stay here today, but if you send an email, your name and your addresses, we will send you samples for free. Thank you very much for your time, and I think I mentioned 60 minutes.
Very nice to be here and nice to see you. And thank you, Anders. Very interesting to hear about the disinfection. And let's talk afterwards also about surface disinfection on natural materials. This is what I'm going to talk to you about. Natural materials in healthcare and in healthcare interiors and how they act with us, both on a sensory level, how we feel in this environment with natural materials, and then of course following your speech, Anders, on surface disinfection and on natural disinfection prior to that. So this is what a healthcare interior in a sustainable way could look like. This is Malmö Emergency Hospital, just across the sea from here in Copenhagen. And this environment has looked like this for 3 years. And I'll show you in a little while what it was before. And I'll speak a little bit of the materials that were there before in a toxic perspective and in a sustainable and durable perspective. And then I'll give you more facts about this interior and about the natural material of wood and the treatments of wood available on a natural level and how they react to bacteria and viruses naturally. So this is my perspective. This is the nature and the nice feeling that nature gives. When we're in nature, our stress levels go down and we feel good. And also, nature has ways of taking care of itself, of persisting with all the bacteria that is present in nature, and all the little animals also eating natural materials. So they have developed ways of dealing with this. And wood is therefore naturally antibacterial to keep with this kind of environment. And many other natural materials in the same way. Food that we eat, have coffee to get rid of it, insects, cacao, the same way. There are a lot of smart ways of nature to handle this. And this is how I started into public interiors. This is Stockholm Central Station, 8.5 years ago, and I was asked to design public seating for this area together with the architects to make something timeless that could fit with this old building, but that could also go with other railway interiors, more modern railway interiors throughout Sweden. And this was a very demanding customer on the maintenance side of things. So they were very careful on efficient maintenance, on being able to wash, to move, wash underneath, and maybe not then disinfect, because that hadn't really reached railway interiors at the time. But that is now the case up there. And one day, the manager of emergency care in Skåne, in the southern region of Sweden, was sitting on this bench in Stockholm Central Station, and she had a problem. Her interior was falling apart in the waiting room in the emergency room in Malmö. And she thought, well, what if I could have this? Obviously, it persists in a tough environment like this, in a railway station. So my emergency room is tough, open 24 hours, Friday and Saturday evenings, you know what it could look like that at those times, but it's still not as tough as a railway environment. So she actually contacted me, which I'm very happy for. And together we developed a healthcare version of this to be even easier to clean and to be able to surface disinfect with the materials you were speaking about. Basically, it can stand anything that your skin can stand. So the natural material of the skin is a good test to the natural material of waxed wood that you have here. And I'll show you in the end also a testimonial from the disinfection nurse, what's it called? There's the title of the nurse.
Hygiene nurse.
The hygiene nurse of southern Sweden, who we worked together with, and who also approved the design to be in healthcare, where we started off. And if we zoom in a little bit, and we back 3 years in time, this is the exact, you can see the pillars in the background, this is the exact same spot, and this is what it looked like, and this is the concern, you can understand it, of the emergency care director. So this is polyurethane seating, upholstered polyurethane, covered with a polyurethane sheet. Back in the days before it still exists, this was a PVC cover, a vinyl cover. And just shortly about the toxicity of these materials. Polyurethane as an upholstery is isocyanate in a polymerization Very toxic from the start. It's not toxic once it's there and in a stable way, but if or when it burns, it's extremely poisonous. And this is basically why people don't get out of public fire locations. And for this reason, it's soaked with flame retardant, so it shouldn't burn. And the flame retardants are equally toxic, basically. So this is, it's not a very nice cocktail to put your patients on. PVC has the ability, I don't know if you remember the touch of PVC, it's a little bit fatty. And your fingers get a little bit fat after touching it. And this is the softeners in the PVC that are solvable and go into your skin. After a little while, you're not fat anymore, the fingers, and where did it go? Well, it's inside your body. And they are endocrine disruptors. They're messing with reproductivity. They're messing with our hormones, especially for pregnant women and children. It's very dangerous. So let's try and stay out of this, and let's try and look at what nature has to give instead. I will just give another example where the technology is now going from the PVC fabrics. There are a lot of fabrics now with Teflon instead. Teflon is a great material as it comes to you can see that the water drops here. It doesn't soak, it's easy to clean. It doesn't stick in your frying pan. But what happens if you overheat that frying pan or when you burn the textile eventually? This is also an extremely toxic material, and it's also persistent. It will stay there basically forever in nature. So PTFE, as you see there, this is the letters of Teflon. And there are now also nano alternatives to this, nano Teflon or nano other things. And nano is so new, we don't know so much about it. We don't know how it affects us really. But just to give you a perspective, this is the Globe Arena of Stockholm. It takes 16,000 people. It's huge. If you compare a blood cell, well, a regular cell in the body, a blood cell, to and compare that with this arena, a nanoparticle is a football of size. So basically, you can play football all over the place through your skin, inside your body. Touching nanomaterials will just go right through you. What they do, I don't know. I don't think so many do. So this is the technology development. I'm sure there will be great materials with this. Just have to be conscious about what we're doing. And if we then look at wood as an alternative, it's something that is very well tested over time, obviously, and natural. So it's just like our body, just like our skin. And it's an antiseptic. And if you use the woods that contain a lot of tannins, like oak, they're also antiviral. They're not antiseptic and antiviral on the level of your disinfectants, and there's, of course, but they also have more time to act. Basically, they bring down the general level of bacteria and viruses on the surface over time. They need to be washed to get the biofilms away now and then, and they need to be disinfected, but they can naturally be that with these materials, and they can act over time. And not to forget the nice feeling that it gets when you enter a sustainable hospital. Brings down the stress level and shows quality of care in a natural and sustainable way. I'll show you one reason why wood hasn't been okay in healthcare. And oh, sorry, I was a little image before. This is just to show you this is a salmon on a piece of wood. Chopping boards have been from wood in long times, and you even chop fish or meat on a chopping board of wood because it's naturally antiseptic. But then going into why wasn't wood okay? Well, it was treated with varnish. This is the traditional way of treating wood. It's basically like putting plastic on wood. It protects very well in the start, but after a while the wood moves and the varnish doesn't follow. And once you get a crack somewhere, the surface disinfectants or the cleaners will enter there and it will crack more, and there will be pockets for germs. And also where you get a scratch, there will be a pocket for germs. So this is why it's not okay with wood in many healthcare locations. Luckily, there is a natural alternative to this, and it comes from the flooring industry. You have seen it probably, the ones coming here by airplane, not so many these days maybe, but Danish people and southern Swedish people know this location very well. It's Copenhagen Airport. It has wooden floors, and they're waxed, and it persists of public use and shoes all day long. So this is where waxing of wood comes from. So it's very durable. And also the wax itself comes from the bees. The bees like to keep their eggs intact. So the wax is also naturally antiseptic, and even these two natural materials, they act together and become even more antiseptic. And it preserves the nice feeling, the look and touch of wood. So you have the feeling of wood still, not the plastic surface of a varnish. It's a wooden, nice material. And looking at nature, bringing nature inside, this is what it could look like. These are woolen lamps, also a nice natural material, bringing the nice feeling inside, also having great acoustics. Real plants and wooden furniture in a healthcare entrance. And this was my talk and my message to you, natural materials in healthcare environments. I'll show you a last slide. I hope, Johannes, that we can share the slides afterwards. This will be my references, so you can check the facts of this. And there's also contact information of the nurse, the hygiene nurse in southern Sweden. So you can reach her and ask her all about this project. So here are the references, and you can either back up to this when you see it afterwards, or you can see the presentation afterwards. Okay.
Thank you very much for that presentation, Johan. I also want to thank Anders Gripenberg for your presentation earlier. I was a bit too slow after your presentation, so I didn't get the chance to thank you. But if you have any questions to either Johan or Anders, you can write them down in the chat. We have a couple of minutes now until the next presentation, so we'll take a 4-minute break. If there are not any questions for Johan or Anders, if you come up with a question later, you can also write it down, because I think both Johan and Anders will stay until the end of the session, if I'm not wrong. So
we're here. Yeah.
You're here, so we can also take it at the end if you come up with anything you want to ask them. So before our next speaker, we'll take a short break, and then we're back with Peter Kelly. Thank you. Okay, so we're back from a small toilet/coffee break. So I think we should just go ahead with our third speaker. Peter Kelly is the International Director of Pharmafilter, and the topic of his presentation is A Cleaner Hospital, A Cleaner Environment. So Peter, you're welcome to start sharing your screen whenever you're ready. Thank you.
Okay. Hello, everybody, and thank you for the introduction. Peter Kelly here. I have two jobs with Pharmafilter. I'm the international director, and I'm also responsible for the production and sourcing materials for our bio-based and biodegradable disposables for use within the Pharmafilter system. Listening to the other speakers, there was a lot that resonated with myself on what we do on a day-to-day basis. And if I could just give you a typical introduction to, let's say, you probably guessed by my accent that I'm from Ireland, and Pharmafilter, a Dutch company. And I look at an Irish hospital and share some of the numbers, a 600-bed hospital. It generally treats about 250 outpatients per annum, and it would sleep overnight 40,000 patients per annum. 3,000 staff, and that would represent a small town anywhere across Europe. Its daily use of water, which turns into wastewater, water in, water out, is about 300 metric tons per day. That's a lot of water. And then it creates between 4 and 5 tons of waste per day. And that waste stream is quite complex. And as you can imagine, the wastewater is highly contaminated when it's being released to sewer. So when we developed the Pharmafilter system, we also had to look at the environmental impact, but also develop something that was financially sound. And I will give you a look at what we do. Hopefully this will play for me now, if I can get it to play. Sorry. There we go. If you look at one of our hospitals, so it's René de Graaf in Delft, Netherlands, and this is what we deploy. It's a modular build system for treating waste and water, and as you can see, it's located in a fairly heavily built-up area. So it's very quiet, no odor, and it's the intersection between the hospital and the main sewer where we treat in this plant waste and wastewater together. It's highly engineered. It runs obviously 24 hours a day, 365 days of the year. We fit all our plants with a fish tank, and there's a reason for that. Where people can see how pure the water is after we treat it and recycle it. The water from this plant is then recycled back to the hospital for the flushing of our shredders, the tontos, and for other uses like flushing toilets and washing vehicles or gardening. There was a time we used to drink this water, but we were stopped from drinking it on demonstrations because we're not a drinking water company. We don't supply drinking water. And within the hospital, then we deploy our shredders, which are called the tontos. But taking a look at what's the hospital challenge, and we look at it across 5 areas. Obviously, hospitals are dispensing drugs and chemical-based products, and they result, if they're not treated upstream, they find their way into the water course downstream. There's obviously a lot of reports knocking about from the point of view of how heavily hospitals are as polluters to the environment. And then there's the real nasty one, hospital-acquired infections and antimicrobial resistance, which is a prevalent problem and growing on an annual basis, and again, supported by a lot of research. The waste from the hospital, well, it's heavily polluted, and what we're getting to see nowadays is that waste is entering our water systems. And what we do upstream is we treat the waste and wastewater at source before it enters the main arena. So Pharmafilter's principles are really very simple, simpler process, obviously safer and more enjoyable, cleaner for the staff and the patients, environmentally and socially responsibility is a big criteria for ourselves. Operational costs, risks, and assistance in reduction of HII and contact moments. Cost is a big factor in dealing with any waste or wastewater because is expensive, and hospitals are under a lot of pressure from a financial perspective on operational costs, and I'll get into that as we get into the program. Waste in itself is it's a very complex process within a hospital, and I've given you an indicative look at what an Irish and UK hospital waste segregation process looks like in this slide. And obviously now we have increased volumes of PPE entering the waste stream. And it was interesting to look at it from the point of view during the height of the pandemic, and elective procedures in hospitals dropped, but you would have expected that the waste volume would have dropped as well, or reduced in volume. No, it wasn't the case. It increased by about sixfold with PPE, and it's all disposable. So that was a major problem for the hospitals, and will continue to be a major problem for hospitals as well, because it's another added area of complexity to the waste stream. As you can see, it is very complex, and it's bag, tag, weigh, record, and that's the old sort of hump and dump, as we call it, way of dealing with waste. But within Pharmafilter, we can dispose of a lot of this by the use of our Tontos on the wards. The Tonto itself is a high-tech shredder, and highly sophisticated from the point of view that it has intelligence, artificial intelligence. It knows where it is at whatever ward, how far it is away from our plant, and it's a plug-and-play system from the point of view that it is connected to the sewer. It is displacing your traditional bedpan washer, Florence Nightingale system of stainless steel bedpans or macerators. But this machine, the Tonto shredder, is taking your waste from the ward, all your mixed waste, including your disposable bedpans and urinals with feces and so forth. So when it comes to bedpans, there are no slopping out in advance of that. Simply dispose of the bedpan within the Tonto, and I'll show you this in a video later on in the presentation. So what are we doing here? We're simplifying the process and the movement of waste throughout the wards, and we're also playing an active part in the reduction of contact moments from the point of view of nursing and portering when it comes to hospital-acquired infections. This is the nasty end of the business, waste and wastewater. Hospitals use a lot of chemicals, use a lot of pharmaceuticals, and it finds its way into the drain and so forth, and it has to be dealt with somewhere along the way. And this is exactly what we do on a day-to-day basis before it enters the mainstream and decontamination and purification. If I take a look at what we actually do, it's a plug-and-play system. And we deploy our Tontos throughout the hospital. So for a 600-bed hospital, we could have 50 or 60 of these shredders located throughout the hospital, plumbed into the existing the sewer system, and connected to an on-site modular build plant, or in some cases we have built special builds. One of our largest hospitals is about 80 cubic meters an hour of wastewater, and that's equivalent to about 40,000 homes per year, and it's built underground. And the shredders are connected to that, to our plant, and then the waste is shredded with the hospital wastewater, feces, urine, all the nasties, wastewater from showers, taps, and so forth, making its way to the plant and for purification and decontamination. So what's happening in this plant is straightforward from the point of view that we're dealing with two influxes as such, wastewater and solids, and we're separating both and taking the wastewater through a complex process of decontamination steps, right through to final UV, if we're recycling the water back to the hospital for reuse as recycled water, and then dealing with the solids through a process of decontamination and taking all the nasties away. Now, from the point of view of a hospital waste stream, hospitals use a lot of the cellulose-based or organic-based products, And we're able to deploy about 50% of that into energy for the plant through anaerobic digestion. So reducing the pull of energy requirement for the plant to run from electrical power or gas power. So for every metric ton of waste that enters our system, and it's pretty typical across all hospitals because waste looks pretty much the same throughout Europe in each hospital, the volumes would just be a different case from the size of the hospital and the elective procedures that the hospitals would be going through. We would see an average of a ton of waste, metric ton of waste, at about 500 kilos then being deployed from an organic perspective, and the anaerobic digester using taking its energy from that, and then left with a dry sludge or fluff as we call it, which can either be recycled, but in most cases it goes for what we call RDF, energy, another energy source. So it's reused from that perspective. What are the advantages of what we do on a day-to-day basis? Well, at this stage, we founded the company in 2008, and to date we have a proven technology, and we're deployed across the Netherlands as a result of it being our home base. But by the end of this year, we will have plants in Ireland, Germany, and Belgium. So that will add on to our existing portfolio in the Netherlands, and next year, UK, Switzerland being added on from that perspective. So we are making our way in the marketplace as a proven technology, and we're beyond the demonstration stage or the research stage from that perspective by the number of plants we've deployed to date. What are we doing really? We're decentralizing and decontaminating waste and wastewater on site upstream, which makes a lot of sense if you take a look at the complexity and the volumes and the contamination of this waste. It's better off if it's dealt with upstream rather than it transported downstream. And what we find with wastewater treatment plants, they find it very difficult to deal with antibiotic-resistant bacteria, and that is really a major problem. Once that antibiotic-resistant bacteria makes its way into a main municipal wastewater treatment plant, it's holiday time. It increases by 8-fold within that environment, and that's not good for long term. We've had to simplify our system. We have a modular build or a bespoke process, but during this process, we also have to prove our economics, and most of our plants are deployed to date on operational savings. So that makes it a little bit easier for the hospitals from the procurement side to when we build a business case and present it. But a lot of hospitals today cannot deal with CapEx and don't want to deal with a CapEx program because they'd like to have money for other services from the point of view of freeing up capital for projects and services and increasing capacity. So what we've had to do is we brought in a program as what we call as a service model agreement, where it's a full turnkey financed program from start to finish, and it's a monthly fee there afterwards for our services. That makes a lot of sense, especially with hospital infrastructure and countries that are under a lot of pressure financially. And would prefer to keep their capex for other elective building programs and so forth. We're also seeing what we have is an increase in hygiene and obviously clinical benefits, because we're now dealing with reduction of contact moments within the hospitals, and we're significantly helping in the reduction of hospital-acquired infections in two particular areas, C. diff and neurovirus, and that would make a lot of sense for people who understand the movement of feces and urine and the movement of waste throughout a hospital. Minimize that, minimize contact moments, and obviously, but you're introduced to your standard hygiene practices and making sure that they happen, you get to see the benefits moving forward from that point. So Our business case is based on the operational cost benefits and the opportunity cost benefits from a hygiene perspective. We're not a black box for increasing waste. We want the waste reduction and recycling programs left in place. And we're obviously a part of a lower carbon footprint, which is part of, we see ourselves as a player within the circular bioeconomy. So the system's benefits from that perspective on the ward is efficiencies and savings, and it takes it through our 5 steps from the point of view of the savings, staff time, efficiency and disposal, and what we use in our disposables or consumables is second generation feedstock in the production of our bioconsumables, which are once they enter the Pharmafilter system, they are converted to energy. So that makes a lot of sense versus the bedpan and macerator systems and the type of disposables that they would use that are really, they are single use, but no benefit of end of life whatsoever. And I know there's a lot of debate about single use and reuse and so forth, but in this case, in dealing with urine and feces, it's not a pleasant business, or in dealing with the management or waste transportation internally within a hospital. And again, we're assisting in the reduction of HAI, and we are actively, we remove antibiotic-resistant bacteria, including COVID-19, from the wastewater stream and from the waste stream upstream, rather than it getting into the overall public infrastructure. So that's talking about our benefits. So it's great from the point of view is when you're introducing a product of this nature and it's a system and a service, but it has to make sense internally because, again, there's sustainable procurement. You're talking about your environmental and your social dimensions, and obviously you're measuring your impacts and your system approach, but you're dealing with pollution, effluent and decontamination upstream. But you have to also deal with finance, and that's really to do with value for money and pressure on the annual operation budgets. And what we have on a daily basis is that we're getting to see more about activity-based funding and measuring the impacts. So we've tried to deal with all of these, and we deal with them in a very positive light. While the facility staff or the engineering staff in the hospital understand what we do, the financial people understand what we do in nursing, get it, and microbiology and infection control absolutely, are one of our major stakeholders within the hospital, understand the benefits of our system and are quite important in the decision-making process. So that's taking the benefits. So when you think about what has already been presented, we're at the end of the pipe. We've got to deal with, the chemicals and everything else that's flushed down that pipe. It has to be dealt with somewhere along the way, and it's better to deal with it upstream instead of it getting into the public infrastructure. So yes, we do completely remove medical residue, antibiotic-resistant bacteria, and COVID-19 from the waste and the wastewater, to the point when I previously stated in the past when there were demonstrations in the hospitals, and especially in Rennie de Graaf, we used to drink the water at the end of the pipe. But again, we were asked to stop to do that. Don't do it anymore. You're not a drinking water company, and that's fair enough. We recycle. What we've managed to do to date so far is recycle about 70% of this water back to the hospital for reuse. That makes a lot of sense. It doesn't make sense to flush toilets with drinking water and to wash vehicles and other sort of secondary uses of water other than, drinking and whatever clinical requirements internally in the hospital. That's a separate field of expertise. But the reality is that it just doesn't make sense to use drinking water for some services that clean, recyclable water can be used for. And it's better off that we deal with all of this wastewater upstream from the point of view of the antibiotics-resistant bacteria and the environmental benefits long-term to our own planet. So I go back to why finance, and again, it's a big part of it. We want sustainable procurement, but there's always the measurement on the finance side. And again, that's why we introduced as a service alongside a CapEx program. If a hospital wishes to engage with us under CapEx, fine. And if they wish to engage with us under as a service and want to use the money in a different area to build theatres or other services in the hospital, and yet deploy a Pharmafilter system and reap the benefits of that, simply put, we developed the business case, and it is a function of that business case that it's sustainable within the business case, and in real terms doesn't cost the hospital any more money than what they're spending on an annual basis. And in some cases, we found savings for the hospital, which is quite significant over a number of years. So it's marrying an environmental solution to a financial solution to a clinical benefits, and also to patient safety and staff safety, and taking in social responsibility along the way, is putting that package together to make it work, because you've got to take all of these things into consideration. But again, we're at the end of the pipe. We're at the nasty part of the business of dealing with complex waste and wastewater that emanates from the hospital. I just want to give you a look at how the bedpan washer, or how the bedpan washers are no longer used in the hospital, and we use our Tonto shredder. This is actually a live hospital. This is right in the graph. And you notice that there's no bins corridors or anywhere else. It's one of our disposable bedpans. They're made out of bioplastics. When it's put into our system, it creates energy. It has a lid on it, so there's no aerosols, and if the nurse was to drop that, it wouldn't spill. This is actually a dirty utility room, a sluice room. Very neat, very tidy. As a result of the Pharmafilter system being deployed, you can see how it works from the point of view of hygiene, and the nurse will now wash her hands. That bedpan has been shredded with urine and feces within it, and then it has been flushed to the Pharmafilter downstream. The shredder also takes the waste, 30 litre and 40 litre bags. We have larger shredders, and we'll be located at the hospital for larger waste items. And as you can see, she has washed her hands, and now she'll leave the dirty utility room. It's a simple system from the point of view, if one of these was to break down, they take about 40 minutes to change out. This is analysis ward, running the graph again, and you get to see how the system is deployed from. This is the front door, obviously. The front door. It's a plug-and-play system. It can be retrofitted to older hospitals, and obviously new hospitals is a much greater advantage with the design of sluice rooms in a particular way to facilitate the Tonto shredder. It's intelligent. It is talking to us all the time and sending details to the hospital as well on the number of cycles. I can even tell you who is using it, and if it senses that it has the wrong material in it, it will not shred it. So it's intelligent from that perspective, that it knows if it's on the dialysis ward, it has to deal with kidneys and so forth that are going to be disposed of, and if it was to receive a hip replacement by chance, it won't. It just simply close down. This is the water from our system being replumbed to it. It's 3-phase electrical, and we have internet, which is speaking to us all the time. Startup of any hospital, we've about 10% extra, because it's in early days we would have carried that number of Tontos, but after a period of time, it's only a couple of Tontos that are required, and that's taken away now, fixed. And you can see the docking station on the floor, and taken through the floor and down to the plant for repair. So it gives you a look at what we do from that perspective. Very neat, very tidy, very, very clean, and very swift. Because we've come across in the past data on bedpan washers being out of out of action for up to 10 days in hospitals because you can't get the maintenance crews to fix them. This is a look at the type of plants that we deployed. It depends on where they are and what the planning permit is and so forth. In some cases you can see that they're a different colour in one, and then they wanted a different type of frontage on another. We've now offices obviously in the Netherlands, Ireland, Germany, United Kingdom and Poland, and really look forward to developing our business in the Nordics from that perspective. And you can see my email address, our website, and my direct telephone number if you wish to contact me. And thank you very much.
Thank you very much for that presentation, Peter. It's now time for the last speaker of this session. But before we move on, I can see that we have some questions for you, Peter. I'm just going to have a look and read them to you. The first question is, what are the most persistent contaminators / pharmaceuticals in the sewer system? Meaning, what substances are you battling to remove from the hospital sewer system?
Oh yeah, we're removing everything that enters that system in the wave that would normally be effluent when it goes to main sewer, the influence. So the list is quite long because of the sophistication of the internal workings of our system, from membrane reactor through ozonation and so forth. We remove everything that the hospital actually throws at us, and we have that data. If somebody would like, if they would, want to reach out to me, I can share the results with them. It is actually in a publication, the STORE report, because we originally were EU funded, so that's available publicly. So we take out everything that's thrown at us from that perspective. Hospital wastewater looks pretty much the same in most hospitals, except for some elective procedures. We find cytotoxic waste, which maybe a little bit more in some hospitals than others, depending on what they're doing in the way of their procedures. But we take everything out of the wastewater system, to a purified to below the detection limits.
Thank you. Could you maybe stop sharing your screen so that we can see you instead?
Oh, sorry.
No problem.
Apologies.
In the meantime, I will read the next question. What are the risks? Oh, sorry.
So I don't know what's gone wrong with my system here. It doesn't like it. Sorry. For some reason, I've lost my cursor.
It's no problem. I can read the next question for you in the meantime. What are the risks using ozone from a safety point of view?
Sorry, would you repeat that again?
What are the risks of using ozone from a safety point of view?
Well, we make all our ozone, and we mitigate against any risk. It's an internal process that we work, and we have. It's one of our trade secrets, how we deploy that and how we work with it and make it work for our own advantage. But what we go through is quite a significant EPA process, an environmental permitting process, and what our elective process here would be. Sorry, get off this now. Am I off the screen? Yeah. Thanks about that. My system locked up on me. Sorry about that, folks. Ozone, yes, we make all our ozone on site. We obviously use it in the water. We also use it in the air handling systems. But we go through quite a very, very strict protocol on the EPA side, and we elect for that. Rather than a permit, we always look for a license because we share that data and technology with the EPA under an industrial emissions license, and we have a full risk mitigation program for the whole plant, including singular processes within the plant.
Thank you. We're actually a bit short on time now. There are a few more questions, but maybe we can answer them at the end. I see that there are one question for Johan as well, but I think we'll save that for the end. And then we'll move on to our last speaker of this session. Nicholas Nehaul is the product specialist at Ecolabelling in Sweden. And he's here today to talk about how Ecolabel laundries lead the way to a non-toxic environment. And I just want to ask all the speakers again, there are not attempting to turn your microphone off. I think it might be worse here. Okay, Nicholas, you're welcome to start sharing your screen. Thank you.
Can you guys hear me all right?
Yes.
Excellent. And you see my screen?
Yes, we do.
Perfect. Good morning. Before I begin my presentation, I would like to thank Sofia and Daniel from PEM for giving me this opportunity to speak to you today. My name is Nicholas Nehaul, and I'm representing Ecolabelling Sweden. I'm here today to talk to you about how eco-labeled laundries lead the way to a non-toxic environment. I'll start my presentation by giving you an introduction to the Nordic Swan Ecolabel. Then describe what an eco-label textile service is, followed by giving you a few examples on the environmental benefits that can be made. I will then finally try to sum it all up in some key takeaways. Some of you may recognize this logo. This is the Nordic Swan Ecolabel. It was established in 1989 following a decision made by the Nordic Council of Ministers. The reason being that at the time, many companies had begun promoting their own environmental work, which led to the formation of many self-claimed or self-made eco-labels. As you can imagine, this created a lot of confusion among the consumers, not knowing the difference or meaning between these different eco-labels. Therefore, the Nordic Council of Ministers decided to develop an official joint Nordic eco-label that the public both could know what it stood for and actually could rely on, known as the Swan. In other words, when you choose a Nordic eco-label product, you can be sure that you're getting the best quality product on the market, as well as choosing the most sustainable and environmentally friendly option. Ecolabelling Sweden is the Swedish part of the Nordic Ecolabel, and we're appointed and work on the behalf of the Swedish government. We're responsible for both the Nordic Swan Ecolabel and the European equivalent, the EU Ecolabel. What many do not know is that we're an independent, non-profit state enterprise. So all of our revenue that we generate is reinvested in developing a new criteria for new product areas, revising and tightening existing criteria, and informing consumers about sustainable consumption, among many other things. The Nordic Swan Ecolabel is a Type 1 ecolabel and follows the standard of the ISO 14024, which means that we continuously tighten and review our requirement and criteria documents. Being an independent ecolabel also means that most of our decision-making regarding criteria, requirements, etc., have to be made by an independent board appointed by the Swedish government. We are also members of GEN, which is the Global Eco-Labeling Network, where we collaborate and exchange knowledge with other Type 1 eco-labels all around the world. Currently, we're approximately 80 employees working in Sweden and more than 150 employees working across the whole of the Nordic region. The Nordic Swan Ecolabel have 61 different product groups, while the EU Ecolabel have 23. These are figures from last year. At that time, we had more than 2,300 Nordic licenses, while the majority of them, more than 1,400 of them, on the Swedish market. I'm certain that most of you recognize this picture. These are the UN's 17 Sustainable Development Goals to reaching the Agenda of 2030. We have identified that the Nordic Ecolabel touches on many of these goals, while our main contribution is towards goal number 12, responsible production and consumption, here displayed with a large swan logo. However, if you take all of our criteria documents in consideration, many of our requirements contribute so that our work have an effect on many of the other goals as well, here displayed with the smaller swans on some of the other boxes. This makes us a tool for our license holders, whom also strive to work according to the UN's Sustainable Development Goals. We're proud to say that independent surveys shows that 97% of the Swedish population recognizes our brand. This is extremely unique for any brand, especially an eco-label. I'm not sure what Coca-Cola's brand recognition is, but I believe we're getting close to it. Personally, my earliest contact with the label was when I was in first grade of school. At that time, all of our notebooks had the swan logo at the bottom of the booklets. So whenever, or till this day, I have clear memories of me when the teacher held, let's say, not so fun classes. I used to mark or fill in the swan logo with my pencil. Each of our criteria documents are usually revised every 4 years. When we develop new criteria documents or revise current requirements, they're always developed, considered from a life cycle perspective, from cradle to grave. To give a more visual example, which I like, easiest for me to understand, is if we take a sofa, for instance. We begin by looking at the materials from which the sofa is made. The wood must be sustainably produced, the stuffing must not contain any harmful chemicals, the fabric must be manufactured using chemicals and good raw materials, approved chemicals and good raw materials, and must be produced under acceptable working conditions. At the finished state of the sofa, it must be long-lasting, and eventually, if it has to be discarded, all the components should be easy to take apart for reuse or recycling. So what is an eco-label laundry, and what requirements do they have to fulfill? Well, I will from now on refer laundries as textile services. You could say the foundation of our requirements focuses on the consumption of chemicals, energy, greenhouse gas emission, and water, all since they have the largest environmental impact. However, we also have strict requirements on textiles, disposal, wastewater, working conditions, just to name a few. Unfortunately, there's not enough time today to go through all of our chemical requirements, or more specifically, all of our laundry detergent requirements, but I'll try to touch on a few. The used chemicals are not allowed to have any hazardous classes or statements according to REACH CLP. They may not be ecotoxic, mutagenic, carcinogenic, or toxic to reproduction, etc. We also have restrictions on the content of harmful environmental substances, chlorine, phosphorus, as well as very tough limit values for the critical dilution volume, CDV. Furthermore, we have a long list of forbidden substances, which includes fragrances, substances on ECHO's candidates list, just to name a few of them. So overall, very tough chemical requirements. Looking at our energy requirement. Our limit values for energy are based on fuel consumption in relation to the total amount of washed textiles. We also take textile categories into account since their treatment require a different amount of energy. For instance, hotel bed sheets require less energy than, for instance, workwear from the oil industry. Each fuel source are also graded depending on the energy content and renewability. As you may presume, we want to limit the use of fossil fuel and try to promote or nudge energy sources that are more renewable. Our limit values for greenhouse gas emissions are also directly linked to the used fuel source in relation to the total amount of washed textiles and also the textile category. One way that we try to reduce the use of fossil fuels is by our sulfur requirement. We have a limit that fuels containing sulfur may not exceed a limit of 0.05 weight percent. Water is a limited and expensive source in most of the world. Funny enough, not so much in the Nordic region. Most textile services, therefore, already have washing systems which recycle washing water. Therefore, many textile services have a relatively low water consumption. However, factors such as poorly filled batches or the need for rewashing may both contribute to a high water consumption. So what are some environmental benefits that can be made? Well, first, I'm going to say that I'm going to try to avoid going into detail on our complex calculations that we've made and instead try to simplify them as best as I can. When we made our energy calculations, we compared Ecolabel Textile Services' annual energy consumption between two different criteria generations. We then found that they had lowered their total amount of energy consumption with 33%, while at the same time increasing the total amount of washed textiles. We then calculated the difference between these two with the current and increased annual amount of washed textiles and found that the saved energy corresponded to the annual heating of a small community, more than 1,400 Swedish households, in fact. We calculated greenhouse gas emissions similarly to our energy calculations, meaning that we compared the amount of emitted greenhouse gases between two different criteria generations and found that the Ecolabel Textile Service managed to decrease their total amount of emission by 27%, while also at the same time increasing the amount of washed textiles. So using those figures, with the increased amount of washed textiles, we found that the saved amount of greenhouse gas emissions corresponded to driving a car from the most southern point of Sweden to the most northern point of Sweden more than 47,000 times. For those of you who are not familiar with how long the country of Sweden is, we can also put that in a different perspective by translating it into driving a car around the world more than 1,858 times. When we made our water calculations, we made them a bit differently. Instead of comparing between two criteria generations, we instead made a comparison of what the water consumption would be if the same amount of washed textiles would be washed in a household washing machine instead of at a Ecolabel Textile Service. We used data from tests conducted by the Swedish Department of Energy, where they had measured the average water consumption of a single household machine. With that data, we calculated the difference in saved water, and it actually corresponded into 133 Olympic swimming pools. I'm not sure if you're familiar with this actual size of a Olympic swimming pool, because I was not. But it actually holds 2,500 cubic meters of water, which can also be translated into more than 660,430 gallons of water. So a huge amount of water. We're also proud to say that the same textile services that we made the comparisons between the two different criteria generations also managed to increase their use of eco-labeled laundry detergents from 13% to 63%. Now just imagine if all textile services around the globe could reduce their use of resources and make the same amount of savings. What a huge impact that would have on our planet, and how much closer we would get to a non-toxic environment. So what are some key takeaways? Well, the Nordic Swan Ecolabel's task is to ensure sustainable production and consumption. When choosing the Nordic Swan Ecolabel, you're not only getting one of the best quality products on the market, you're also choosing the most sustainable and environmentally friendly option. So by choosing a Nordic Ecolabeled textile service, we're getting much closer to reaching the non-toxic environment we want to have. Thank you very much. Now, if any of you have any questions, please leave them in the chat room. And you're also welcome to contact me if you have any further questions.
Thank you very much for your presentation, Nicholas. I can see that we have one question in the chat, and we have about 3 minutes left for the session, so I will read the question to you now. The swan labeling seems like a time-consuming and thereby costly process. Are there subsidies for smaller companies who might not have the economic capacity to receive the logo/certificate?
I'm sorry, I barely heard you. Could you repeat the question?
One more time. The swan labeling seems like a time-consuming and thereby costly process. Are there subsidies for smaller companies who might not have the economic capacity to receive the logo/certificate?
Great question. We do not have, when you have a swan label or an eco-label certificate, you have an eco-label certificate. We do not grade them indifferently. However, we like to work so that most companies can achieve our requirements. So if you're a small company with, let's say, smaller resources, feel free to contact us and we'll see what we can arrange for you to achieve a eco-label certificate.
Perfect, thank you. I don't know if we have Johan still with us, but I know that we have a question for you if you are here.
I'm here, Sofia.
You're here, okay.
Oh.
Well, your question quickly then.
Okay.
The question for you was, what about flammability of natural material alternatives?
Yes, very good question. So we're all public locations here with the healthcare locations, and it needs to be fireproof. We have an experience of public locations from all over the world, railway stations and airports and healthcare locations, health hospitals, and we meet almost all fire requirements from all parts of the world. So there are natural ways of doing that as well, and also most importantly, when things burn and they're natural, the gases are like a campfire instead of like by the polyurethane I named, for example. I could also say on the eco-labeling, we are eco-labeled. So continuing on that question, we are eco-labeled, and it's not a really big deal, at least if you know what you're doing from the start, and it's not a major cost either. Great thing. Thank you.
Thank you. Okay, so we have a short break now until the next sessions. 2 parallel sessions start at 1 p.m. on smart healthcare and resilient healthcare. Thank you to all of the speakers and for everyone who listened in on this session. And I'll see you later.
Great.